Hi everybody. So today I am starting my series. This is the first video of maybe two or three on trauma. And I'm going to start with PTSD, or post-traumatic stress disorder. I actually try really hard to stay away from the word trauma because when people hear that, they tend to think about a certain set of experiences that qualify as traumatic, and completely discount anything else. So instead, I like to use anything that overwhelms the brain's ability to cope. So when you think about trauma in terms of that definition, it really opens up the possibilities. So PTSD develops after one or more exposure to one or more traumatic events. And you can either experience it for yourself, witness it, or even learn about it. So it doesn't have to mean that you have to experience something, firsthand in order to develop PTSD. PTSD can develop after a threat of injury or death, a serious accident, combat, terrorist attacks, physical and sexual assaults, natural disasters, which, after Hurricane Harvey coming through here last year, I'm treating a lot of people for PTSD related to that. Those who, lost their homes or flooded, and those who, were just here during that time. And then physical, sexual, or childhood sexual or physical abuse. So there are 4 categories of symptoms with PTSD. The first one is intrusions. So if you notice yourself having any recurring distressing memories, thoughts, flashbacks, dreams, those could qualify as intrusives. Avoidance is the second category. Are you avoiding any people, places, or circumstances that may remind you of the traumatic events? The third category is persistent negative mood or thoughts. Do you have a difficulty recalling those traumatic events? Or experiencing positive emotions. People might also have excessive blame, fear, guilt, or shame. And then they may also notice a detachment from others and themselves, which might be related to dissociation, which will be a topic in a future video as part of this series as well. And then you may notice the fourth category, arousal or reactivity. So are you irritable, hypervigilant? Do you notice yourself having difficulty concentrating? Do you have any self-destructive behaviors? So those are the 4 categories. I actually don't want to spend any time going over statistics because I think it's really underreported. People don't realize that they have PTSD, and then there's a lot of shame around having PTSD. Really common that people who do develop it feel as if they're weak or flawed or not good enough, they aren't strong enough. And again, that goes back to that excessive blame, shame, and guilt. PTSD is completely treatable. I use cognitive behavioral therapy to treat the anxiety and depression symptoms that may come along with it. And then my main reason for being EMDR trained, eye movement desensitization and reprocessing, is because I was having so many people come through my door with PTSD and didn't really feel adequately equipped to treat them. But EMDR is one of the best treatment modalities we have for PTSD, and that'll be a topic for a future video as well. Some people may find antidepressants or anti-anxiety medications helpful, but let's get this straight. Medications are not going to treat the root cause of it. They will only treat the symptoms. So if you think that taking those medications is going to cure your PTSD, you are wrong. If you want to learn more about trauma and PTSD and treatment modalities, one of the best books I can recommend is The Body Keeps a Score by Dr. Bessel van der Kolk. Trauma rewires your brain, and through therapy, through CBT, through EMDR, we rewire that rewiring. So if you have any questions, have any comments, leave me a message, whatever it may be, and look for future videos on dissociation and EMDR. Bye, guys.